Today I am going to discuss about the anatomy and physiology for the GNM first years, and we are going to discuss about the 6th unit, that is respiratory system. And in last class we have seen about the pharynx. So today we are going to discuss about the larynx in the respiratory system. So today topic is larynx, and first we will discuss about the larynx. So the larynx or voice box links the laryngopharynx. So the larynx, it is also called as voice box. So because of the sound produced by the larynx, because of this it is called as voice box, and the larynx or voice box. So the larynx also called as voice box and links the laryngopharynx. So laryngopharynx can be situated above the oropharynx, and below it can be continuous with the esophagus. So the laryngopharynx can be connected with the above oropharynx, and below it can be connected with the esophagus. And next one is trachea, and it is become 44 mm in males. So the larynx can be size, there is a long length of this larynx in the male, there is a 44 mm in the males and the 36 millimeters in the females. So there is a larynx, length of the larynx become in males it is become 44 mm and in females 36 mm, and it is made up of skeletal framework of cartilages and joints, ligaments and membranous, and which connect the cartilages and muscles. So the larynx can be made up of skeletal framework, and it can be connected to the cartilages. Cartilages means there is a soft connective tissue, and it can be protected and covers the long bones. So end of the long bones can be covered by the cartilages. So it is a soft connective tissue. It is connected, it protects and covers the end of the long bones, and the become joints, and joints it is a articulate between two bones. And next one is ligaments. There is a ligaments, it is a soft connective tissue, one bone can be articulate with another bone. And next one is membranes, it can be thin membrane and which connect the cartilages and muscles. So muscles, it can be help in the movement of the body. So movement of the larynx. So it is a larynx. So the larynx or voice box links the laryngopharynx and the trachea. And the larynx, it is also called as voice box, and it can be situated above the oropharynx, and it can be continuous with below esophagus. And next one is, it is become 44 mm in males and 36 mm in females. It is a larynx, and there is a relations. So relations, it includes anteriorly. So anteriorly the larynx can be connected to the larynx anteriorly. It can be connected to the muscles attached to the hyoid bone and the muscles of the neck. So the anterior part of the larynx can be attached to the hyoid bone and the muscles of the neck. So hyoid bone can be situated anterior of the neck. So hyoid bone is situated anterior part of the neck and muscles of the neck. The hyoid bone can be situated anterior part of the neck, and it can be situated between the mandible and the larynx. So it is a hyoid bone. Hyoid bone means there is a hyoid bone, it can be situated anterior part of the neck, and it can be situated between the mandible and it is nothing but chin, and between the mandible and the larynx. And the next one is attached to the muscles of the neck. So the anterior part of the larynx can be attached to the hyoid bone and the muscles of the neck. Hyoid bone, it is a situated anterior part of the neck and between the mandible and the larynx. Next one is posteriorly, the larynx can be attached to the laryngopharynx and third and sixth cervical vertebrae. So laryngopharynx, it can be attached to the above oropharynx and below it continues with the esophagus and the third and sixth cervical vertebrae. So there is a 8 cervical vertebrae. So in this 8 cervical, the larynx, posterior part of the larynx can be connected to the third and sixth cervical vertebrae. So there is a posterior part of the larynx can be connected with the third and sixth cervical vertebrae and laryngopharynx. Next one is superiorly, the larynx can be connected with the hyoid bone and the root of the tongue. So the superior part of the larynx can be attached to the hyoid bone and the root of the tongue. And next one is inferior part of the larynx can be continuous with the trachea. So inferior part of the larynx can be continuous with the trachea. Next, lateral part of the larynx. So the laterally, the larynx can be attached to the lobes of the thyroid gland. So laterally, the lobes of the thyroid gland can be attached to the trachea. So larynx, and it is the relations. So first anteriorly, the muscles attached to the hyoid bone and the muscles of the neck. Hyoid bone, it can be situated anterior part of the neck between the mandible and the larynx, and posteriorly the larynx can be situated with the laryngopharynx and the third and sixth cervical vertebrae, and superiorly the larynx can be attached to the hyoid bone and the root of the tongue. Next, inferiorly, the larynx can be continuous with the trachea. Next one, larynx laterally connected with the lobes of the thyroid gland. So it is the relations of the larynx. Next we will discuss about the structure. So structure, it can include the structure of the larynx. It consists of 9 cartilages. So in this 9 cartilages, 3 become unpaired cartilages and 3 become paired cartilages. So the structure, it consists of 9 cartilages. In this unpaired 3 cartilages and paired cartilages. In this unpaired cartilages, it become 3 types, and the paired cartilages, it become 2 types, and it is the structure of the larynx. So structure includes the 9 cartilages. In 9 cartilages, it includes the unpaired cartilages and paired cartilages. In this unpaired cartilages, it become 3 types, and paired cartilages, it become 3 types. So first we will discuss about the unpaired cartilages. In this unpaired cartilages, first one thyroid cartilage, and the next one is cricoid cartilage, and next one is epiglottis. So first one is thyroid cartilage. So thyroid cartilage, it is become large and prominent structure. Thyroid cartilage become large and prominent structure. It can be seen mostly in the adult males. So the males become adult. So in this age group, we can see this thyroid cartilage, and there is a large prominent structure which can be seen mostly in the adult males, and there is it consists of 2 sheets, and the 2 sheets can be joined together anteriorly, and it can form the laryngeal prominence. So it can form the laryngeal prominence. So thyroid cartilage, it is a become large prominent structure. It mostly seen in the adult males and it consists of two sheets. So the two sheets can be joined together and anteriorly it forms the laryngeal prominence. So it forms the laryngeal prominence. So it is called as Adam's apple. So it is called as Adam's apple. So thyroid cartilage, it is become large prominent structure. It can be seen mostly in the adult males and there is a form of two sheets and it can be joined and form the anteriorly laryngeal prominence. It is called as Adam's apple. So next one is cricoid cartilage. So cricoid cartilage, it is a ring of cartilage. So it becomes ring of cartilage and it surrounds the trachea. So it can be, trachea can be surrounded by the cricoid cartilage and this cricoid cartilage can be situated in middle or center of the neck. So it is a cricoid cartilage. Cricoid cartilage means it is a ring of the cartilage and it surrounds the trachea. So it can be situated between the middle or center of the neck. And the next one is epiglottis. Epiglottis means it is a leaf shape. So the epiglottis become leaf shape and it can be situated behind the tongue and it can be situated behind the tongue and above the larynx. So it is epiglottis. It can be leaf shape and it can be situated behind the tongue and above the larynx. So the main function of this epiglottis, there is a seal the windpipe. So while taking the food, it can be sealed. Windpipe can be sealed by the epiglottis. So while taking the food cannot be enter into the lungs. So it can be protected by the epiglottis. So the unpaired cartilages includes the thyroid cartilage and cricoid cartilage and the epiglottis. Thyroid cartilage means there is a large prominent structure and it can be mostly seen in the male adults. So there is a two sheets and there is a formation of two sheets and it can be joined by, it can be joined together and it can be anteriorly form the laryngeal prominence. So laryngeal prominence, it is called as Adam's apple. And next one is cricoid cartilage. There is a cricoid cartilage, it is ring of the cartilage and it surrounds the trachea. So it can be situated middle or center of the larynx. And next one is epiglottis. There is a epiglottis become leaf shape and it can be situated behind the tongue and above the larynx. And there is the main function of this epiglottis, there is a sealing the windpipe and while taking the food cannot be enter into the lungs. So it can be protected by the epiglottis. So it is a unpaired cartilages. Next one is paired cartilages. So in this paired cartilages, first one is arytenoid cartilage. So arytenoid cartilage means there is a arytenoid cartilages means it can be situated behind the back of the larynx. So it is called as arytenoid cartilage. It can be situated back of the larynx. And next one is the corniculate cartilage. So the corniculate cartilage, it consists of small nodules. So the small nodules can be connected attached to the arytenoid cartilage. So it is called as corniculate. Carniculate means it consists of two small nodules and the small nodules can be connected to the attached to the arytenoid cartilage. So it is called as the corniculate. And next one is the cuneiform cartilage. The cuneiform cartilage means there is a small, it can be supports the vocal folds and the lateral part of the epiglottis. So the cuneiform cartilage, it can be support to the vocal folds and the lateral part of the epiglottis, and it is a paired cartilages. Arytenoid cartilage means there is a arytenoid cartilage, it can be situated back of the larynx, and the corniculate cartilage means there is a two small nodules, it can be attached to the arytenoid cartilage. And next one is cuneiform cartilage. There is a cuneiform means there is a, it can be cuneiform cartilage includes the, it can be attached to the lateral part of the epiglottis and the support to the vocal folds. Next one is blood supply to the larynx, and there is a blood supply includes the arterial blood supply. There is a superior laryngeal artery. So there is a superior laryngeal artery. It is a branch of the superior thyroid artery. So from this thyroid artery, it is a branch, and there is a superior laryngeal artery. It supplies the blood to the larynx. So arterial blood supply includes the superior laryngeal artery. It is a branch of the thyroid artery. And next one is venous drainage. So venous drainage, there is a superior laryngeal vein and inferior laryngeal vein. So there is a superior laryngeal vein and the inferior laryngeal vein. It is a branch of the thyroid vein, and it can be drains the blood from the thyroid vein, and it is superior laryngeal vein and the inferior laryngeal vein. And next one is nerve supply. The mucosa above the vocal cord is supplied by the interlaryngeal nerve. So the nervous supply to the larynx. So the mucus of the larynx, the vocal cord can be supplied by the interlaryngeal nerve, and below the vocal cord by the recurrent laryngeal nerve. So below part of the larynx can be supplied by the recurrent laryngeal nerve, and above the vocal cords can be supplied by the interlaryngeal nerve. So it is a nerve supply to the larynx. And next one is functions. So the main functions of this larynx is it helps in the production of sound. So the main function of this larynx is it helps in the production of sound. So the volume and sound, the volume and voice can be depend upon the force and with which the cords vibrate. So the sound can be depend upon the vocal cords, how much sound can be vibrate, how much sound can be created by the vocal cord, and it can be depend upon the vocal cords vibration. So the main function of this larynx is it can be helps for the production of sound. It helps in the production of sound. And next one is passage of airway. So there is a passage of airway between the pharynx and the trachea. So there is a passage between the trachea and pharynx. So the larynx can be helps in the passage of air between the pharynx and the trachea. Next one is protection of lower respiratory tract. So there is a protection of lower respiratory tract. So these are all the functions, and the main function is helps in the production of sound. And next one is passage of air between the pharynx and the trachea and the protection of lower respiratory tract. So next one is hyoid bone. So hyoid bone, it is become U-shape, and it can be U-shape, and it does not articulate with any other bone. So it cannot be attached to the any other bones, and it is a become axial skeleton. So it is a does not attach to the any other bones, and it is become U-shape, and it can be located anterior neck between the mandible and larynx. So there is a hyoid bone can be situated anterior part of the neck and between the mandible and the neck larynx, and it supports the tongue and providing attachment sites for some tongue muscles and the muscles of neck and pharynx. So the hyoid bone can be supports the tongue, and it can be attached to the tongue muscles and the muscles of the neck and the pharynx. So, the hyoid bone is mainly U-shaped and it is an axial skeleton. It does not articulate with any other bones, and it can be situated anterior part of the neck between the mandible and the larynx, and it can be supports the tongue and muscles of the pharynx and the neck. It is a hyoid bone and it is about the larynx. So, thank you.